Welcome. Well, this only took about, what, 12 years? So my name is Jason Schulist. I am the Executive Director of the Fox Valley Data Exchange, and I welcome you here to our formal launch. So the Fox Valley Data Exchange was incorporated as a nonprofit in May of 2023. And our mission is to serve as a centralized resource for all of you for community data for the 3 counties, providing the research, analysis, and interpretation of trends and issues. We want to make this easy for everybody. So today is the public official launch of the website. Just want to make sure I had it right. So what is the need for this? And we did a lot of needs analysis, which I will show you on the next slide, but we want to be the easy button for data. So when you are looking for data about our community in the area, it's one place, a one-stop shop that's easily accessible. You can get it on your phone, you can get it on the website, and it makes it really useful for you to use as data. You could see that we want to be aligned. So we have 7 different stakeholder groups that have come together to work on this to help decide what data to put on the website, as well as how to align it with the 7 vital conditions framework that we have here down below. So using different tools and different approaches to look at our data for well-being. This all started back in 2020. I went back and looked, and it was Peter Kelly and Kurt Dachin who I talked with to say, is there a there? And I used to be on the United Way board, and so we were looking and we noticed there's a lot of duplication in our community, people scrounging for data. I was contracted in a healthcare environment to find data for somebody and for a CHIP plan. And in 2021, we decided to get the community together during COVID, not physically, but on Zoom, the new tool, and surveyed over 40 local organizations and had 3 listening sessions with a bunch of volunteers that came together to design and help to figure out what our minimal viable product would be. In 2022, we compared technology solutions. So we selected Metopio as our provider to help us. And in 2023, we created the Fox Valley Data Exchange and then started to convene volunteer action advisory groups. We've had over 25 people volunteering within this last year to help make this possible. And today is our public launch. So I know Tammy, who will be coming up shortly, likes to use the word minimal viable product. Does anybody know that word? Has anybody heard of it before? It's this, it's like an IT thing, right? But it's the idea of like, can you go fast? It only took us 4 years, but can we go fast to define what we need and then test things and then continue to adapt? And so I'm not going to go over all this in detail. However, a couple foci here. One is we wanted to be full tri-county so that we weren't just the Fox cities. So we've been intentional on that. We wanted to have cross-community issues aligned with community frameworks, and we chose the 7 vital conditions for well-being. One, that because it was used in the Imagine Fox Cities work as a frame, and then also the healthcare systems have been looking at that as they're looking at their combined chip-chop process with public health. We wanted to have visuals, so we want to be able to click and look at maps and get trends and make it nice and easy. So we figured that part out. And then also from a local data integration side, we wanted to have governance that was good so that you could trust the data that we put on the site. And finally, a little bit of analysis. We're still going to be using all of the volunteers from our community to help us in all of these aspects to keep the cost low. So now I would like to introduce Wendy Krieger, the Chief Operating Officer of United Way Fox Cities, and Tammy Geenan, Vice President of Community Engagement from the Community Foundation of the Fox Valley region. Not only have their organizations been key to launching this exchange, but they've been personally involved in making this a reality. So please give them Thanks.
Thank you, Jason. So we're really excited to see the Fox Valley Data Exchange come to life. Our community data is part of everything we do, and it's critical to our impact in the community. So Tammy, I just want to take a moment to reflect and acknowledge the shoulders that we've stood on to get here. And some of them are in the room.
That's right, Wendy. The Community Foundation for the Fox Valley region and United Way Fox Cities have a long history of collecting community data and using it to invest in nonprofit organizations throughout the Fox Valley region. Since 2001, that has happened through the Fox Cities Life Study. For more than 20 years, the Life Study has met that need, shining a light on what's been great in our region and also opportunities for improvement.
So in the past few years, the community started to realize we can do this better. We need to expand and evolve and partner in new ways. One example of other organizations that are also collaborating in new ways is our nonprofit healthcare systems and our 5 public health entities. So historically, each one producing their own community health needs assessment, usually using similar data, pulling from the same community resources and coming to similar conclusions. We realized there's a better way to do this. And just as those organizations, again, those leaders are in the room today, thank you so much for your collaborative spirit. We've decided to come together to bring together stakeholders and identify shared measurements, identify a North Star for our community, and better align our efforts to make meaningful change in our communities.
So we knew in order to bring together more partners representing all aspects of our community, we would need to pivot and change the approach of the Life Study. So that is what provided the spark for creating the Fox Valley Data Exchange as an independent organization covering a full 3-county region. It truly is an evolution of the Life Study. And while change can be daunting, you will see today just how many enhancements have been made, new partnerships that have been created, and how a fresh look, fresh data, and new features can help provide a new opportunity for thinking differently and in new ways across a tri-county region. So with that, up next, I'd like to introduce Rachel Podolsky, who is going to dive deeper into this exciting new website. Thank you all for being here.
Thank you, Wendy and Tammy, and thank you to United Way and Community Foundation for over 20 years of the Life Study. Really amazing work was done with that. So I like to use this analogy that if the Life Study was MapQuest, the data exchange is like using GPS on your smartphone. We all remember the days of MapQuest, right? You enter your starting point, your destination. It gives you those turn by turn. Print it out, bring it in the car. Whoever's in that shotgun seat is responsible for reading off that paper, right? But what if there's a detour? Or what if you need to stop for gas and can't find your way back to the highway? Not as much help. The GPS on your smartphone, on the other hand, is like having this super knowledgeable co-pilot. You don't even have to have anyone there to be reading it off to you. It notifies you when conditions change, if there's a traffic jam, and it will adjust as you go if you decide to take that detour to the gas station or for a bite to eat, right? It's redirecting your route in real time. And that experience of navigation is just so much smoother and more efficient. And that's really what the data exchange is going to be able to do with our community data. So just a few of the enhanced features that you'll see on the site here. You've heard it a few times already, but it is covering a full 3-county footprint: Calumet, Outagamie, Winnebago counties, and sometimes beyond where the municipal boundaries extend. Lots of really fun interactive visuals, maps, tables, charts, lists that provide a rank order. And for those out there who are data wonks like me, all of the source documentation and methodology for the data points, if you really want to dig in deep. Speaking of digging in, you can kind of drill down on some data as the sources allow. Things like municipality, zip code, census tract, which is really neat. One huge improvement, and this is just because technology has come so far in the last few years, but data is updated in a very timely fashion thanks to the APIs that are built from the source data into the tool. Pretty much as soon as that source is updating, it's getting piped into the Metopio site, cleaned and prepped, and then pushed out onto the data exchange for you all to view. That data is also available for download, the visuals as well, so that's a really handy. And last but not least, easily integrating local data, which we just kind of recognized was an opportunity from the life study. There's lots of great work happening and lots of great data being collected, and this is that centralized place where we can showcase some of that work and that data. Okay, this is a use case from the Habitat, and they're in the audience. I see some folks turning. Just kind of sharing how they have used the Fox Valley Data Exchange to inform their work. Here we go.
I'm Amy McGowan. I'm with Greater Fox Cities Area Habitat for Humanity, and I am the Director of Development here. So my role is to connect supporters, sponsors, donors to the important work that we're doing in our community. Rock the Block is a neighborhood revitalization initiative really focused on a specific targeted neighborhood. We have done 24 neighborhoods in the Fox Cities and surrounding region. When we're in a particular neighborhood, we're trying to do community projects and home repair projects that help improve the neighborhood, connect neighbors, and ideally have long-term effects on the vitality and the safety of the neighborhoods that we're working in. When we're looking at our whole service area, we want to know where the need is greatest and where the Rock the Block would be most impactful. So we utilized the Fox Valley Data Exchange to get some of that data. It was great to have a tool that pulled all of those sources together. We looked at the housing cost burden, the vulnerability index, and some of the racial ethnicity indexes as well to try to show like where the need was in our community and where this program would have the most impact. The Fox Valley Data Exchange really helped us collect the information much more quickly than we've been able to do before. So we were able to spend time focusing on executing the Rock the Block instead of hours and hours getting this data so we would know, how to choose the best neighborhood. I would just like to say how crucial this resource is for nonprofits like ours. Having a no-cost tool available to quickly access this data is invaluable. It takes a lot of time to pull all these sources together, and so being able to quickly go to the Fox Valley Data Exchange and see what you need and really make good decisions on how our programs can be the most beneficial as possible to our community.
That's pretty powerful stuff, right? By making data accessible and actionable, not only can it help shape decisions, but it can really drive some meaningful change and impact, creating more resilient, healthy communities in the Tri-County region. And it's really hard to imagine all the ways that this data will be used. I look forward to seeing you all go out there and get your hands on it and apply it to your work and your life. And as you can see on the screen, there's really not a sector that this doesn't touch or this couldn't benefit. Not just funders and nonprofits, but healthcare and government, businesses, education, even faith communities. So without any further ado, you saw a few snippets of the site in that video, and we have all the way from Chicago, Metopio representative here, Angie Grover, to show us around the Fox Valley Data Exchange.
Way back when I had short hair, that was COVID. Well, my name is Angie Grover, and I'm the co-founder and CEO for Metopio. And people don't really get emotional about data, but literally seeing you all in this room chokes me up a little bit, because the work that we do and why Metopio exists is because we want to empower people to take data and focus their efforts on communities that are under-resourced in a way that's meaningful and that you can track change. So the fact that you are all here, you're all going to use data and you're all going to take it into the community and make it actionable, like, really does make me almost tear up. So we work across the country with organizations. I have to say the group that we've worked with has been above and beyond phenomenal with the expertise and the care they've brought to the site. So I get to give you a tour. I do this almost every day on our platform. I also want to give a shout out to whoever put this amazing package together that will also help you understand and get around the site. But our hope is that by putting data in the hands of the public, we can build healthier, more resilient communities. And so I'm going to just take a couple minutes and give you a tour of the site, because seeing is believing. This is where the magic happens. And so there's lots of resources, because you guys have been invested in the community for a long time, and we've organized them so that you can dig into those vital conditions of well-being. So addressing whether you call them social determinants of health, health-related social needs, whatever it may be that you're concerned about, this is not only about the individual, but the community that they live in. So all three communities here in the Tri-County area. So if I was coming here to look at data, I could pick a place that I care about, and this dynamic site gets you beyond a dashboard. So I just want to give everyone, how many people have gone to a dashboard and they show you a county against the state and it's not the one you want? Like, that is so frustrating, right? You have work to do, and how are you ever going to track down that data? And so we have counties, zip codes, cities and towns, and census tracts. So you can look for the place that you care about. I just drove by. Let's see. Oh, sorry. Oh, what did I do? Ah, it's not my computer, so I'm not well versed on it. Hang on one second. So I just drove by Nina, right? Nina? Yeah. So, I pull that up. I can now dive into Nina if I wanted to, or I can choose any one of the topics. And this is one of the cool things about the work from the life study and from this group moving forward under the 7 vital conditions. They're organized under those categories. So you can dive into any one of them, click in here, and you can see all the categories. You can use this to look for maybe income. The data dictionary is really meant to be easy for you to use keywords to find things that you're interested in. I'll use this filter because it also shows you how the data governance works, which is really important. Rachel talked about all the technical documentation. This is meant to be a resource to build data literacy and data confidence. I don't know about you guys. One of the funny things is older adults are now defined in lots of different ways. I'm now an older adult, and I think my 13-year-old is learning Python. So there's a whole bunch of us in between that learning Python and in the workforce that we need to use data, but we're not data scientists. So this is built for everyone. I am not a data scientist. I have a data science team who does all of this data curation, so you have it at your fingertips. So it's meant to be really easy. You can look through any one of these layers. I always joke census tract is so awesome because it gives us granularity, but no one knows what census tract they live in. Does anybody know what census tract they live in? Awesome, let's talk afterwards. You may probably know a precinct or something too. But so here are all the layers you can access. You can type in that place like Nina if I wanted to. We also have longitudinal data. So outside of COVID, these data sets come from public entities. And so they don't change a whole lot very quickly. And so you want to look at that over time. So we upload as much of that as we can across the longitudinal or across those data sets so you can see that change over time. And then stratifications are super important. This is where we get to dive into disparities and subpopulations. How does something impact a population differently than it looks when you look at the whole population? So I'm just going to type in my favorite topic here, which is median household income. Let's see, where did we go? Here we go. And you can see all of that data is there. You can tell what it is. It gives you a definition, the units, the time period, if it has stratifications, and that citation. So a lot of times when we're working in data, we see people have access, people who have access to the data don't always have lived experience, and people with lived experience don't always have access to that data. So how are they supposed to advocate for themselves? How do we level that playing field? So this is really about bringing not only data literacy, but data equity to the conversation. I'll just dip into this real quick because this is where all the data nerds in the room can find all of their technical documentation for how this topic was curated. So if you've ever done a data presentation, someone's always like, where did you get that data? And you're like scrambling for your citation. It's here at your fingertips. And I can say that I get median household income from ACS table B19013. That pretty much shuts them up. They know what you're talking about. You know what you're talking about. And so if they went back to that table, they would find the same data that you have. So now for the cool stuff, I'm going to jump in and visualize this topic. So it's going to give me all 3 counties at the county level. But everything is customizable, and that's what makes it so great for the community. You can get what you need. So we can go to the census tract level. You see each of the counties are outlined here, and we can dive into any one of these census tracts. You'll see the tract number and its value there in the upper left-hand corner. Wherever I go, I get that definition with that green eye, so I'm never caught off guard about where I'm getting the data. But I think most people don't know where their census tract is. We're going to use zip codes. You'll see that the joy of America is not everything fits in a box. And so the zip codes go outside of our 3 counties, but obviously they're part of our community, right? So we're looking at median household income on a map. There are a ton of different ways, and I could be up here for an hour, but I'm going to go a little bit fast and refer you to this amazing guide for how to do this and show you a couple tips before I walk away. But you can change the layers as you've seen me do. We can change the topic right here. Look at this map across different topics. If it has stratifications, you can dive into those. Again, that's where we can look at subpopulations. One of the coolest features is to do a filter. Every topic on this, on the Fox Valley Data Exchange has a slider. Everything is divided into quartiles. So if I want to see where median household income is maybe below the median, I can create that heat map that gives me a focus for where I want to work. It goes either way. I can look at where it's high, where it's low, and I can put additional topics on there. So I can they're not linked, but they're layered. So you can see where they coexist. And in this handy dandy thing, it gives you an address. You can put single addresses on here. So you can type in, maybe the food pantry or, the community center for kids or whatever it may be. And you can put that point on the map. When you're all done, you get to download it. Well, there are map settings. You can change background and color, so really create whatever you need. But you can also download either the image or the Excel file. So again, for our data folks who just need the data to put in your own models or your own spreadsheets, you can download it. Or you can just take this image and put it in the grant application and say, fund us, because we want to work here. And so that's pretty powerful. Yeah, easy peasy. Just download a map and get some money, right? I wish it was that easy. So one of the, another thing I didn't say about the data, just 2 things I want to point out. None of this is PHI or PII, so no personal health information or personal identifiable information for anybody in the healthcare sector. We did this on purpose because we want this to be shareable and actionable. And so there is no personal information on this. And most of these sources are surveys. There's not a lot of count data on here. So you'll see these little tiny I bars at the top. That's the confidence interval or the margin of error. So you just
These things are always at your fingertips so that you have all the data that you need to make decisions. This is median household income, so I'm going to do my favorite stratification here, and I'm going to show you by race ethnicity. So that was pretty easy, just to dive into those subpopulations. And again, you can customize this in any way. So the last thing I'm going to show you is this ranking table, which is very cool. This gives you the rank. So we were on the county layer, but if we wanted to dive into your favorite census tracts, we could go all the way down to the census tract layer, and we can rank from the highest to the lowest. You can do this across multiple topics, and you can focus in on certain areas. And really, this is the data table that goes along with that map. If we created a heat map, you might want to create this data table so you have that data right next to the map, and then nobody can catch you otherwise. You have all the data that you need. Again, everything is downloadable, customizable, and if you think that I talk fast, I have got some tips for you in terms of how to get additional help. So we created some video tutorials. These tutorials, there's a couple videos for you. They'll walk you through the key steps. We also have, if I can collapse some of these here on the side, the ability to ask questions here of the knowledge base. So if you are a visual person, you got videos. If you're a written person, you've got a knowledge base that you can ask a question like, oh, she did that map. How am I going to get that map back? You know, you can customize your maps right here, and it'll support you on the screen. And you know, we've talked about, you know, the organization. I know we're going to dive a little bit more deeply into the vital conditions for health, but really our hope in supporting your fantastic group is that the technology is just the conduit to the action you all take to come together, organize around whether you're doing a community health assessment. We do those across the country. It's nice to have them, and it's nice to put them out there so people understand, but have them take their piece of it. Maybe you work on food issues, or maybe housing. I'm a housing first advocate. I do a lot in housing, and that's a top tier issue these days. Maybe that's my lane, but we all need to work on these issues across the board in order to make our communities richer and more healthy. I'm going to just say, is there anything I missed, or am I good for the drive-through? All right. Well, we know that you will be able to access and support it, and I'm along with Rachel. I cannot wait to see what you guys do with this. Thank you so much.
Thank you, Angie. So we decided, as we were looking at our data and how we would structure it, that we would use the vital conditions for well-being framework. And so as we were doing well-being surveys back with Imagine Fox Cities, we learned that there's this model that helps you to improve your well-being. And so the well-being survey that we did in 2019 and 2021 was about whether we were suffering, struggling, or thriving. And so that's the same stuff that the happiness report's based on. So if you ever look at the happiness report, and I did, and then the first time we were doing the 2019 survey, because I was on the data team, which was part of how this all got started too, I was like, we're gonna just beat, we're gonna beat every country in our well-being. And we were like exactly what the United States was, which was like 20th on the list. So I was like, oh. So we represent America in 2019 at least. But as we looked at we've been looking at the 7 vital conditions framework because this is about asset building. It's not about deficit. So if we can start looking at humane housing, reliable transportation, basic needs for health and safety, and then we can measure these things, it'll give us a good indicator of how we can go where we want to be versus just closing the immediate gaps. So we also learned that belonging and civic muscle was a twofer. So while it's in the middle, and Bobby Milstein will be here in a second, or he is here, but he'll be speaking to you in a second. But this belonging and civic muscle is like a double lever. So the more we can invest and spend our time understanding belonging and civic muscle, and the more we can move it, the more our well-being will increase. So that's what I'm excited about, is that we can focus on these areas. We can see where there may be some gaps, and that will help us with our overall investment as a community in our work. So now what I'd like to do is introduce Bobby Milstein, who is the Director of System Strategy for the Ripple Foundation and Rethink Health. And he just popped up, I think, in the upper left-hand corner on my screen. Hopefully he's over there. He was actually the leader in development of this vital conditions framework and is attending remotely from far east in Boston. So what I'm going to do is stop sharing my screen here, and we're going to see it like a 6-foot Bobby head as we put him on the spotlight for everyone. So there you go. This is Bobby Milstein.
Thank you, Jason. It is a real treat to celebrate with you and the whole team on the launch of this. I'm really hyper aware that my picture is larger than life, but from where I sit, the work underway in Fox Valley and the launch of this data exchange that's the really big story. I've visited Fox Valley a couple times over the last several years, and I've followed the development of this data exchange from its earliest days. And I just want to say at the top that I am a great fan of the pioneering work that all of you are doing. This is truly impressive in every way. The efforts to organize around these vital conditions, coupled with such a strong commitment to chart progress, it's just one of the most mature expressions of this work across the country. It's not only expanding as more and more neighbors in the Fox Valley are joining the work, but I've seen firsthand how your story, what's going on in Fox Valley, is inspiring counterparts in other places to do similar things in their communities. And that's how big nationwide movements take hold, community by community, player by player, recognizing that what I think you're doing is setting a new benchmark for what state-of-the-art multi-sector action really looks like or ought to look like. It's a grand quest to thrive together through shared stewardship, but it's also combined with this practical commitment to establish vital conditions for everyone, leaving no one behind, so that you can celebrate achievements where you have them and you can concentrate on the shortcomings as the unfinished work ahead. That kind of dedication, it's just no surprise that so many players across Fox Valley have seen the value in creating a shared data exchange. I say that's not surprising, but it's really nothing to take for granted. There are countless communities across America that are, I think, headed in this exact same direction, but Fox Valley is what I would view as one of the first and the fastest to build this kind of infrastructure. You're setting a standard for how to make the most of place-based, wide-angle data that encompasses all of these vital conditions, demonstrating to everybody that each piece matters, but also the connections among them are unmistakable. So when I look to the future, I see the emergence of a nationwide network, call them place-based observatories or lighthouses, places that are using information in really practical ways to energize a rising movement to thrive together. I think that future is already taking shape right here in Fox Valley. I'm glad you emphasized that dual role of belonging civic muscle. It's at the center of this framework, and I think the very existence of this data exchange is a sign of your willingness to invest in the infrastructure that allows stewards to be able to do their work and to play at their best. It tells me that belonging civic muscle is already growing and probably likely to grow even stronger as you equip more and more people with the information they need to be able to, to contribute their parts. So I'll just say on behalf of our team at Rethink Health, on behalf of fellow stewards everywhere, I'm really looking forward to working with you, learning with you, and discovering what this work can deliver in the years ahead.
Thanks, Bobby, for those kind words. And we're really motivated to stay on that leading edge. We know none of this would have been possible, though, without financial and in-kind support. So I wanted to share a little bit about that, too. So thank you for our sponsors. I don't know if you want to stand up and each of you give a 5-minute, no. But Community Foundation of the Fox Valley Region, the United Way Fox Cities, Thrivent, US Venture, the Community Foundation, David L. and Rita E. Nelson Family Fund. That's very small on this slide. The United Way of the Oshkosh Area United Way and the Oshkosh Area Community Foundation, Theta Care, Lawrence University, and Oshkosh Corporation. So you can either stand up or stand up. Why not stand up? That's good. Please stand up. Please. Second of all, we have all of these groups. So we have action advisory teams in marketing, in data alignment. We have people we call data dingoes, which are like the total people that like to structure data. So everybody's got a persona. Where are the pandas in the room? Public health pandas, I see them over there. Okay. Anyway, so there's a whole group of organizations that have been supportive, and you can see them on here. And it's just been great to have 7 different stakeholder groups. We have 3 different counties. So we want to continue to build this out to have a larger and larger group of people who are really helping to make the decisions about this. So what the 100 and some metrics that are on our site, that was all decided by those groups, not by me just picking them. So I got to pick the framework, but otherwise the team has really been doing great work together. And then specifically, I want to shout out 2. One, the Fox Valley FVTC Technical College, and specifically Amira in the corner there. So you can stand up. So Fox Valley Tech has hosted this event, supported the action advisory teams, has a member on the board of directors. Did they make it? Yes, made it from a board meeting. As a special shout out to Amira. She's been all over the place. She's on the website. She did social media planning. She helped plan this event. She helped me not freak out when we were doing tech earlier today. She named the website. So it was vitaldata.fvdex.org. So it's just been great. And then also extra special thanks to Thrivent. So Thrivent, not only are they a supporter, but they had this opportunity where several of their data and analytics resources from across the nation volunteered on an 8-week project with us. So, and these were like analytics people, but, and so they supported 3 separate projects. One was the benchmarking of the vital conditions. They went around to all the different places that are doing vital conditions in the nation, interviewed them, and found out what they were doing so that we could get recommendations of what we should do differently. What was nice is that we, just like Bobby said, we were kind of on the leading edge. So that was great to learn, but we also learned from them, and we made relationships with all the others. So we're going to continue to have kind of like a community of practice between Inland Empire in California, Central Washington, all of West Virginia, all of Delaware, and I'm sure I'm missing a few of the other ones too that we benchmarked. They also supported in the design of local data integration. So we're still working on where we're going to host the data, and so they've been supporting that help on that. And then finally, they did a little NLP. Anybody know what NLP is? Oh, I didn't either. Natural language processing of the qualitative data that we had to help to find, kind of with some AI and some other algorithms, try to find out like what were people saying so that we could see where the gaps were. So that report's going to come out, and we'll be publishing. We're probably going to do a webinar with Thrivent to kind of help us go through the data, but that'll be something for us to share, and then we're going to share the report out to all the other organizations that were in the benchmarking. So just a gift to have that firepower and support around data. So thanks, Jenny. So next steps, a couple that we're planning to do for 2025. One is we're going to start to integrate local data sources. So the sources we have now are primarily these national and some state. We're going to get down to some of the local sources. These aren't necessarily the ones we're going to put on there. These are just for representation, but we've been talking about 2-on-1 data. Could we get 2-on-1 data geographically mapped against where people's services and needs are? We've talked with the Appleton Area School District about are there certain things that we might want to add around lifelong learning and so on. We've actually had interviews with several different stakeholders in the area so we can start to understand, and then the action advisory team is going to prioritize and start to launch these local data sets into this website, as well as on the back end. So if you think this is nerdy, or the website, we're going to have a whole back end data dictionary, and we're going to have the whole set of interoperable data that we can start to do analysis on to make better decisions. And then finally, the plan is to administer an annual well-being survey. So like we did in Imagine Fox Cities, we want to start to create a cadence where the 3 counties can have an annual well-being survey, hopefully next fall. And then we'll start to have, like this, we'll have a data day once a year where we're going to kind of have an update. How are we doing as a community? What else have we added? And then you can all just throw checks at us too as well. So it could be the other thing. So how can you help? We have a few areas here. One, if you're interested and you like data, or you like marketing, or you like HR, or you like finance, you can volunteer on an action advisory committee, or if you're interested in being on the board, we're going to have the next set of board members in May of next year. So there's a data framework and integration committee, marketing communications right now that's live. So if you're interested, we'd love your help. Also, share your local data with the Fox Valley Data Exchange. If there's something that you think could add value, that this is a one-stop, easy shop for people to see the data, that'd be great to kind of bring that data in. Promote the usage of this through your network. So I'm sure all of you are going to go jump at those screens at the end of this, or jump over at the food, but to start using it, playing with it, and then sharing it with other people. And then also improve the well-being and make data-informed decisions in the work that you do. And then last of all, donate. It's a $1,050,000 ask for a 3-year launch. We're at $433,000 yet to raise, so we're still looking for support in that way. So, in summary. So in summary, none of this could really happen without you, the community. Look at the crowd out here, and I think we have, how many people online? 23 people online right now. So we collectively are what makes our community thrive. And when we look at our community data, understand the opportunities in front of us, and work as multi-solvers to address community well-being, we start thinking and acting in new ways. And we can build the vital conditions of our community. We can focus on growing our belonging and civic muscle, and we can reach the aspiration of all people and places thriving, no exceptions. So thank you for attending, and I'm honored to be really your shepherd in helping this Fox Valley Data Exchange that's for you, the community. So thank you very much. So we have a little bit of time. I'd like to bring up all of the speakers up to the front, and this is question time, just like in England, so you can ask any question you want. And the question was, are there other ways that you can stratify the data within a geography, and are there other geographies that you could actually add? Yeah, so within the 3 counties, we have some flexibility to do something, and we've talked about jurisdiction, I think, as the one that we might use, because I think public health uses the jurisdiction, and it confuses between when you have, like, you used to have a Menasha and a Menasha, and I'm sure there's some of those other where there's a town and a city. So these jurisdictions kind of also are similar to census tracts, but they don't overlap, and so they're kind of a little more cubist in the way. But school districts, we haven't looked at that specifically yet, but I mean, that's possible. The other thing is we can, the scalability of this is pretty decent. We wanted to hit our minimal viable first, but adding things like a Washoe or Wapaka County is not that difficult. Other questions? Doug, where do we send our local data? Well, the local data right now, where's Susan? Oh. Susan is where you send local data. And Susan has kind of been leading the Action Advisory Committee, and our data dingoes, so she manages the dingoes, the pandas, the vicuna, which is, I think is is what the vital condition vicunas. But she manages kind of these personas to help coordinate like what to bring in and whatnot. We've had, if you're interested in providing data, we'd love to have an interview because we have a nice little template of how do we fill out so we know exactly what people might be interested in and what we might provide. Anything you'd like to add there?
On the Metopio site, there is a option underneath helps and tools that says contact us. So if you have local data and you wonder who can I give it to, you can just jump in there and send a message. It will go to Jason and he'll make sure that we're connected. Also questions, if you see something about a topic that you wonder about, you could just send it along and it'll get to the right person.
Any other questions? We have 6 more minutes maximum. The question is, are we tracking who is using the data? It is free, so anybody can use it. However, about tracking.
So the platform is built so that you can see traffic and get metrics by traffic, but because it's a public site and most of this is government data, we're not tracking individuals.
Can you open, like as a user, can I have an account where I can save my data sets that I that I use often? Or do we just download?
So there are workspaces available and I'll let Jason and his team identify how they're going to share those workspaces. But I would say that one of the most interesting things, I'm also not a software developer. I just had an idea and got some good people together to do this. So one of the most interesting things is the data is so easy to get. When we first launched this, I thought everybody would save things and they don't because they can just go back and pop them up right away. So the workspaces allow you to save insights, but really it's easy as knowing which data sets that you use most frequently and you can just pull them up. I will just say too, across all our sites, and because there's such a robust user group here, we'll continue to improve this and your site will benefit from that. So whether it's favoriting topics or other things. So if you have feedback about the site, I know that the team here would love to hear about it, but that will also get back to us because we want to develop the technology in a way that it best serves the community.
Going once. Going twice. Sold. Well, thank you very much for coming. I appreciate all the support and look forward for you using it in the future.